The most commonly used approved instrument in Ontario is the Intoxilyzer 8000C. This breath instrument uses infrared technology. Breath is blown into the instrument through a tube and then to a sample chamber. Infrared light passes through the chamber and some of it is absorbed by the alcohol. The percentage of light absorbed is quantified and produces a signal that is converted into a reading. Lawyers need to understand that there are several potential problems with infrared-based instruments if they are not used properly and maintained properly. Because these instruments quantify alcohol in breath and multiply by 2100 to 1, they have to obtain and use deep lung air. If the calculation is based on stomach alcohol or mouth alcohol or a burp or a belch or vomit, then the sample is not suitable, the sample is not being obtained properly, and the calculation, the analysis, will not be reliable. As you will read in the blog at www.impaireddriving.com, 0, for purposes of the subject tests and for purposes of the calibration checks, floats. 0 in the instrument's electronics changes frequently depending on ambient conditions. Ambient conditions in the breath room can include ethyl alcohol, that's drinking alcohol, floating in the air, an interferent, that's a substance that behaves in some ways similar to ethyl alcohol, an interferent floating in the air, electrical interference in the power supply, or radio frequency interference in the breath room air. Because these instruments are sent out for maintenance at best once per year, there must in Canada always be an alcohol standard system used by the qualified technician to conduct calibration checks. Reliable calibration checks are essential to approved instrument reliability. Accessory equipment such as the Guth 2100 are used to conduct calibration tests. Defense lawyers can learn a great deal more about the normal operation of an Intoxilyzer 8000C by taking my course at udemy.com. This course focuses on Intoxilyzer 8000C sequences. Go to the Intoxilyzer 8000C page at impaireddriving.com and click on the link. Use the discount coupon CABINET. Click on the link and it will take you to the Udemy course. There's a video there that you can watch and learn more about the course. Please remember that the nature of an infrared instrument requires that there be a sequence of steps to every breath test. In Canada, that sequence is ACABA or a variation of that sequence, sometimes with extra air blanks and extra diagnostics checks, as with the 8000C. ACABA stands for air blank, calibration check, air blank, breath test, and air blank. This course will teach you normal operating sequences with an Intoxilyzer 8000C so that you can identify error and do a better job of cross-examining qualified technicians and forensic science experts.